NLN NEX reading questions. Question 1. Which answer best explains the author's point? A nurse calmly repeated discharge instructions and asked the patient to explain them back in this endocrine message item. Option A. Repeating words proves the nurse is confused. Option B. Discharge instructions should be avoided. Option C. Patients should memorize medical terms first. Option D. Teach back checks whether the patient understands instructions. The correct answer is option. Having the patient explain instructions confirms understanding. Repeating words proves the nurse is confused, is not supported by the passage. Discharge instructions should be avoided, is not supported by the passage, and patients should memorize medical terms first, is not supported by the passage. Question 2. During a quick NEX review of a glucose regulation item, which answer best explains the author's point? A graph showed water intake rising each week after reminders were added to a wellness app. Option A. Reminders may have encouraged more consistent water intake. Option B. A water intake decreased every week. Option C. The graph proves reminders cure illness. Option D. The app removed the need for habits. The correct answer is option. The passage connects reminders with increased intake. Water intake decreased every week, is not supported by the passage. The graph proves reminders cure illness, is not supported by the passage, and the app removed the need for habits, is not supported by the passage. Question 3. After checking the choices in a chart reading item, which answer best explains the author's point? A paragraph compares online classes with classroom learning by discussing flexibility, cost, and interaction. Option A. The paragraph tells a fictional story. Option B. The paragraph gives a step-by-step procedure. Option C. The paragraph is organized by comparison and contrast. Option D. The paragraph lists only causes. The correct answer is option. The paragraph examines similarities and differences between two learning formats. The paragraph tells a fictional story, is not supported by the passage. The paragraph gives a step-by-step procedure, is not supported by the passage, and the paragraph lists only causes, is not supported by the passage. Question 4. If a ratio setup stem gives one clear clue, which answer best explains the author's point? A volunteer program grew after former patients shared personal stories at orientation. Option A. Orientation should never include stories. Option B. A former patients stopped the program. Option C. Personal stories can motivate people to participate. Option D. A volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Orientation should never include stories, is not supported by the passage. Former patients stopped the program, is not supported by the passage, and volunteer programs grow without communication, is not supported by the passage. Question 5. When time is limited on a unit conversion question, which answer best explains the author's point? A study guide placed key formulas in boxes and practice questions beside each formula. Option A. Formulas should never be practiced. Option B. Pairing formulas with practice helps students apply concepts. Option C. Practice questions replace all instruction. Option D. Boxes make formulas incorrect. The correct answer is option. The guide connects a rule with immediate application. Formulas should never be practiced, is not supported by the passage. Practice questions replace all instruction, is not supported by the passage, and boxes make formulas incorrect, is not supported by the passage. Question 6. Given the information in a percentage item, which answer best explains the author's point? A patient reports dizziness after standing quickly from a chair. Option A. Standing always improves circulation. Option B. Chairs cause infections. Option C. The symptom may be related to a sudden blood pressure change. Option D. Dizziness proves a broken bone. The correct answer is option. Dizziness on standing is commonly linked to blood pressure shifts. Standing always improves circulation, is not supported by the passage. Chairs cause infections, is not supported by the passage, and dizziness proves a broken bone, is not supported by the passage. Question 7. Suppose a similar fraction item appears on test day, which answer best explains the author's point? A passage describes how sleep, nutrition, and review schedules all affect test readiness. Option A. Nutrition prevents all test mistakes. Option B. Only sleep affects learning. Option C. Schedules do not matter. Option D. Test readiness is influenced by several habits. The correct answer is option. The passage presents multiple factors that support readiness. Nutrition prevents all test mistakes is not supported by the passage, only sleep affects learning is not supported by the passage, and schedules do not matter is not supported by the passage. Question 8. While working through a timed mean score set, which answer best explains the author's point? A lab note says the control group received no caffeine while the experimental group received caffeine. Option A. The control group provides a comparison for the treatment. Option B. Caffeine is the dependent variable. Option C. The control group receives the treatment first. Option D. The experimental group is ignored. The correct answer is option. A control group helps show whether caffeine made a difference. Caffeine is the dependent variable, is not supported by the passage, the control group receives the treatment first, is not supported by the passage, and the experimental group is ignored, is not supported by the passage. Question 9. Before choosing an answer in a probability set item, which answer best explains the author's point? A school added quiet study rooms, and students reported fewer distractions. Option A. Students no longer needed to study. Option B. Reducing distractions can improve study conditions. Option C. Quiet rooms increase noise. Option D. Distractions are always helpful. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Students no longer needed to study is not supported by the passage, quiet rooms increase noise is not supported by the passage, and distractions are always helpful is not supported by the passage. Question 10. A student sees this test strategy idea on a NEX review. Which answer best explains the author's point? A nurse explains that antibiotics treat bacteria but not viral colds. Option A. Viruses and bacteria are identical. Option B. Colds always require antibiotics. Option C. Antibiotics treat every infection. Option D. The key point is that treatments must match the cause of illness. The correct answer is option. The explanation distinguishes bacterial and viral causes. Viruses and bacteria are identical is not supported by the passage, colds always require antibiotics is not supported by the passage, and antibiotics treat every infection is not supported by the passage. Question 11. One main idea practice problem tests this skill. Which answer best explains the author's point? A chart shows pulse rates before and after exercise, with higher rates after activity. Option A. Pulse is unrelated to activity. Option B. Exercise can increase heart rate. Option C. Charts cannot show change. Option D. Exercise always lowers pulse. The correct answer is option. The before and after pattern shows increased heart rate after exercise. Pulse is unrelated to activity, is not supported by the passage, charts cannot show change, is not supported by the passage, and exercise always lowers pulse, is not supported by the passage. Question 12. Several choices look tempting in an inference clue item. Which answer best explains the author's point? A paragraph begins with a claim, gives two examples, and ends by restating the claim. Option A. The paragraph has no conclusion. Option B. The examples are unrelated to claims. Option C. The structure supports the main idea with examples. Option D. The claim is hidden in a footnote. The correct answer is option. The organization uses evidence to reinforce the point. The paragraph has no conclusion, is not supported by the passage, examples are unrelated to claims, is not supported by the passage, and the claim is hidden in a footnote, is not supported by the passage. Question 13. For this author purpose nursing entrance question, which answer best explains the author's point? A patient skips breakfast before a long class and later has trouble concentrating. Option A. Nutrition may affect attention and learning. Option B. Classes prevent hunger. Option C. Concentration is unrelated to food. Option D. Skipping breakfast always improves focus. The correct answer is option. The passage connects lack of food with difficulty focusing. Classes prevent hunger is not supported by the passage, concentration is unrelated to food is not supported by the passage, and skipping breakfast always improves focus is not supported by the passage. Question 14. In a short summary task practice STEM, which answer best explains the author's point? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. Hand hygiene cannot affect infection. Option B. The refresher removed all risk permanently. Option C. A training increased infection rates. Option D. A training may have improved compliance with hygiene practices. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection, is not supported by the passage. The refresher removed all risk permanently, is not supported by the passage. And training increased infection rates, is not supported by the passage. Question 15. Among the choices in a sentence correction item, which answer best explains the author's point? A tutor tells a student to eliminate choices that contradict the passage before guessing. Option A. Guessing is always better than reading. Option B. Contradictory choices should be selected first. Option C. All choices are equally likely after reading. Option D. Eliminating impossible choices can improve test accuracy. The correct answer is option. The strategy reduces the number of plausible answers. Guessing is always better than reading, is not supported by the passage. Contradictory choices should be selected first, is not supported by the passage. And all choices are equally likely after reading, is not supported by the passage. Question 16. Using the facts in a punctuation review question, which answer best explains the author's point? A short article explains that dehydration can cause fatigue, headache, and dark urine. Option A. The article compares hospital departments. Option B. The article reviews bone injuries. Option C. The article teaches grammar rules. Option D. The article is mainly explaining signs of dehydration. The correct answer is option. All listed details point to symptoms of dehydration. The article compares hospital departments, is not supported by the passage. The article reviews bone injuries, is not supported by the passage. And the article teaches grammar rules, is not supported by the passage. Question 17. Based on the clue in a pronoun agreement item, which answer best explains the author's point? A paragraph states that teamwork improves safety because it helps staff catch errors early. Option A. Communication is unrelated to safety. Option B. Teamwork removes the need for training. Option C. Errors are always intentional. Option D. Teamwork can reduce mistakes by improving communication. The correct answer is option. The passage explains how teamwork supports safety. Communication is unrelated to safety, is not supported by the passage. Teamwork removes the need for training, is not supported by the passage. And errors are always intentional, is not supported by the passage. Question 18. Consider this high-yield parallel structure concept, which answer best explains the author's point? A student highlights every sentence and later cannot identify the main point. Option A. Every sentence is always equally important. Option B. Highlighting guarantees understanding. Option C. Main ideas should never be located. Option D. Highlighting too much can make key ideas harder to find. The correct answer is option. The problem comes from failing to distinguish key information from details. Every sentence is always equally important, is not supported by the passage. Highlighting guarantees understanding, is not supported by the passage. And main ideas should never be located, is not supported by the passage. Question 19. Near the end of an active voice review session, which answer best explains the author's point? A clinic sends appointment reminders, and missed visits decline. Option A. Patients cannot benefit from reminders. Option B. Reminders can help patients remember appointments. Option C. Reminders caused more missed visits. Option D. Appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Patients cannot benefit from reminders, is not supported by the passage. Reminders cause more missed visits, is not supported by the passage. And appointments no longer need scheduling, is not supported by the passage. Question 20. Across similar capitalization check nursing entrance questions, which answer best explains the author's point? A science passage explains that enzymes work best within certain temperature ranges. Option A. A temperature never affects proteins. Option B. Enzymes are not involved in reactions. Option C. Enzyme activity depends on conditions such as temperature. Option D. All enzymes work best when frozen. The correct answer is option. The passage focuses on how conditions influence enzyme function. Temperature never affects proteins, is not supported by the passage. Enzymes are not involved in reactions, is not supported by the passage. And all enzymes work best when frozen, is not supported by the passage. Question 21. Since only one choice fits the clinical scenario clue, which answer best explains the author's point, a paragraph describes a problem, then lists 3 practical ways to solve it. Option A. The paragraph uses a problem solution structure. Option B. The paragraph is a poem. Option C. The paragraph avoids solutions. Option D. The paragraph is only chronological. The correct answer is option. It first identifies a problem and then presents solutions. The paragraph is a poem is not supported by the passage, the paragraph avoids solutions is not supported by the passage, and the paragraph is only chronological is not supported by the passage. Question 22. From the information in a community clinic item, which answer best explains the author's point, a medication label says to shake the bottle before measuring the dose. Option A. Shaking changes the drug into water. Option B. Measuring should happen before reading labels. Option C. Shaking helps distribute the medication evenly. Option D. Dose accuracy does not matter. The correct answer is option. Some liquid medications need mixing for an even dose. Shaking changes the drug into water is not supported by the passage, measuring should happen before reading labels is not supported by the passage, and dose accuracy does not matter is not supported by the passage. Question 23. At a testing desk during a student survey review, which answer best explains the author's point, a passage notes that older adults may be at higher fall risk because of vision changes and muscle weakness. Option A. Older adults never fall. Option B. Muscle weakness improves balance. Option C. Vision changes prevent injuries. Option D. Age-related changes can increase fall risk. The correct answer is option. The passage names changes that can make falls more likely. Older adults never fall is not supported by the passage, muscle weakness improves balance is not supported by the passage, and vision changes prevent injuries is not supported by the passage. Question 24. Inside a wellness app science or skills item, which answer best explains the author's point, a study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A. Timed sets remove all content gaps. Option B. Comfort never changes with practice. Option C. Timed practice can build exam familiarity. Option D. The exam has no time pressure. The correct answer is option. The passage connects timed practice with increased comfort. Timed sets remove all content gaps is not supported by the passage, comfort never changes with practice is not supported by the passage, and the exam has no time pressure is not supported by the passage. Question 25. Through careful reading of a practice timer stem, which answer best explains the author's point, a chart compares 3 study methods and shows the highest scores for mixed review sessions. Option A. Mixed review had the lowest score. Option B. Mixed review sessions produced the strongest outcome in the chart. Option C. Charts cannot compare outcomes. Option D. All methods had identical results. The correct answer is option. The chart identifies mixed review as the highest scoring method. Mixed review had the lowest score is not supported by the passage, charts cannot compare outcomes is not supported by the passage, and all methods had identical results is not supported by the passage.